Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Hello, everybody. My name is Dr. Brian Keintz. I'm the Dean of Nursing and Nutrition at Keiser University here in Fort Lauderdale, Florida. Keiser University is a very prominent provider of health graduates in the state of Florida and throughout the nation. In Florida, we are a leader in providing nursing graduates in healthcare areas in the healthcare industry. We are also a leader in nutrition with programs that produce certification for registered dietitian nutritionists. KU is also very prominent in all kinds of nutritional fields, occupational therapy, and we have a variety of programs. Really, any healthcare field, undergraduate or graduate, we likely can meet your needs, and we are excited. This group we have here today, we are going to talk about AI, artificial intelligence in healthcare. The group we have here are a group of professors who are from the graduate school. Now, the graduate health it's a small element, honestly, within Keiser. Keiser is very large. Many associates and bachelor's level programs. The graduate school, it has over 1,000 students enrolled in the graduate school who are in advanced programs. And in health, we have approximately 300 students who are enrolled in all kinds of graduate programs, over 300 students. So we are definitely helping the healthcare field. Just a quick overview, and you can look these up if you go in and look on the website to see more about our programs. We're going to talk about nutrition. We have nutrition and nursing professors here. We have other areas, but in nutrition, we have the Master of Science in Clinical Nutrition, which is a BS and MS degree combination program, resulting in a certification, qualification to be certified as an RD. Also in nursing, we have a Master of Science in Nursing, and also a family nurse practitioner in women's health, advanced practice programs, as well as a Doctor of Nurse Practice. So we have a great variety of programs, and you're going to hear from some very, very prominent leaders within Keiser University in these fields. All of the programs discussed today are accredited. They're accredited by their program accredited, which means their appropriate accreditor, professional accreditor, says that they are worthy programs. They follow all the credentials that are required by the profession, as well as the Keiser University is a SACS, a COC accredited regional university. And so we have the highest levels of accreditation at Keiser University. KU is ranked among the top schools in the United States by the U.S. News and World Report. It's one of the best in social mobility, which means we are an institution that can help any of our students become able to advance their careers, advance their education, advance their knowledge in their lives. So we're quite good at it, and we hope we can help you. So let's talk a little bit today about artificial intelligence. Of course, very much a buzz topic of this year, last year, the last few years. We are talking about it almost every day at Keiser University. The folks that I have here who will speak to various elements in healthcare related to AI, they are expert because they talk about it, they read about it, they go to conferences, they study, and they know the application in education. But they want to talk a little bit about its application to the healthcare field in their area. Now, as we know, artificial intelligence provides all kinds of benefits It's transforming healthcare. It has for years by enhancing diagnostics, improving personalized treatment, increasing efficiencies. And probably one of the greatest benefits is that it can increase the speed and accuracy of diagnosis. But of course, there are costs and challenges to that. One of the challenges is the fear that it will reduce the need for administrative research and operational tasks by humans, and so that's a fear. There's also a fear with regard to availability of all kinds of data that could be hacked by cyber criminals, and there are other risks. I think some of the guests here today will talk a little bit about that. So I'm going to turn it over now to the panel and let them speak about various areas, and then we'll come up with questions. I would invite any of the panel members to raise questions to their colleagues. I will raise some questions as well, but we'll start with a few introductory comments. So the first question I'd like to pose is to Dr. Mundy, who is a professor of nursing, and she's the academic program coordinator for the MSN in Women's Health NP, and this program is new. It's the first year at Keiser University. It is the only women's health master's program in the state of Florida, and it is an excellent program. Dr. Mundy, we're delighted to have you today. Would you please tell us a bit about AI and how it's transforming healthcare and medicine, including telemedicine and remote services? We know you have a great deal of experience in that area.
Yes, thank you for the introduction, Dr. Keintz. So yes, for certain, telemedicine is definitely a hot topic in healthcare. For one thing, it definitely increases access to care. I see it every day, and I'm glad that I'm able to provide telehealth to some of my patients, because if they can't get in to see me in 3 or 4 months, telemedicine will allow me to see them within, at least 2-3 days, maybe even within a week. So it definitely increases access to care. It also helps with patient interaction. All right. So if you ever go on and you're signing on, you can even get scheduled that way. If you have any questions for the provider, for admissions or registration, you have the little chat box. So that helps to increase engagement with the patient too as well. That's one way to go about it. Also with telemedicine and AI, it can help to do the intake. So when you come in, instead of being in the office, doing your intake, which was paperwork before, which we all remember, and it would take like an hour or two. They tell you to come before to have that done. You can do that the night before, or you can do it the morning before you come in. I'm sure that some of you have seen too, you can even check in way before you even get there, which is all related to AI as well, and that helps with telemedicine too as well. One huge thing I think that AI and telemedicine has helped out with is decreasing burnout for the providers. So we're seeing the benefit on the side of patients, but it also helps to reduce the burnout for the providers, which we all know is a very, very real problem when it comes to healthcare. And that's where a lot of people leave as well, which we saw through COVID. So COVID helped to bring telemedicine and hopefully to help decrease the burnout. But yeah, burnout is a very, very real thing in all of healthcare. So I think between telemedicine and AI, it definitely does help with that. And also, telemedicine and AI can help to create an optimal plan of care for your patient, something that maybe you may not think of, but you put everything into the system and then it formulates a plan of care. So you're, oh, yeah, I never thought about that resource for this patient. It would have brought it up. So definitely different areas that it can help healthcare and providers and patients at the same time.
So, Dr. Mundy, you work in telehealth almost every day, every week. Is there a concern? Is there any concern as we talk about security, cybersecurity, doing patient care over the internet through portals? Is there a reason to be concerned about that?
That's always going to be a concern. Whatever facility that you may be, employed at, they usually definitely do their best to make sure that that's in place, that does not happen. But it's always going to be a risk when it comes to AI. for certain.
Okay, excellent. Thank you for your expertise. We hope you'll continue and with us, and if there are other questions, we certainly will pose them when it comes to this area. I'd like to switch it over now to Miss Goolsby. She's going to talk about how AI influences nutrition and dietary planning. Miss Goolsby is the clinical leader for the nutrition department, graduate nutrition department. She is also a doctoral student in the Ed Leadership program, getting her EDD. She has a master's of nutrition and has a BS from University of Connecticut and an MS in nutrition from Boston University, and she is a registered dietitian. Ms. Goolsby.
Thank you, Dr. Keintz. Much as what Dr. Mundy said, dietitians are also using telehealth and are using AI more and more ever since COVID. Particularly, dietitians are using AI as a research tool. We can look at AI, some of the sites that are available, you may have heard of ChatGPT, but one in particular called perplexity.ai gives you can actually ask it, please give me a scholarly article on nutrition genomics. And we can go ahead and verify that the article exists and review it for ourselves to make sure it is a quality article from which we can plan our care for our patients. So we can use that as a research tool. We can also use that kind of AI tool to begin to make nutrition care plans, especially menus and things like that. A lot of our clients come to us, as much as we hate to make menus for patients because we want them to understand the principles of nutrition and make them themselves, it's a good way to get started, and it's what our clients often want. So we can type that in, we can say the parameters of our diet that we need, and it will give us a diet pretty quickly. It really is a time saver. And we can look at that, of course, and make sure it's accurate. I mean, we are not at the point where we're going to trust AI completely to just give us information and present it to a patient. But it does save so much time when we are doing our research to begin with. The same with food composition. People who work in food science, or the people that are behind apps, there's so many apps out there where you can type in what you eat and it tells you how many calories and things like that. Well, we can use AI instead of pouring through books that we used to have to pour through to get the specific micro and macronutrient content of a particular food. We can now use AI to do that. So it really has been a time saver. You know, a lot of people talk about AI and they're afraid of it, but if we embrace it wisely and think of it as they thought of the calculator back when they were using the abacus, we might be able to really get some work done quicker and be really there for our patients and clients and provide information that they need when they need it.
Great job. Thank you.
You're welcome.
Well,
thank you.
I do have a question, though. I mean, since you brought up the example, I think that abacus makers are very upset about the invention of the calculator. So I just want to know, you know, our RDs are relatively rare in the world, over 100,000, just over 100,000 worldwide RDs. So my question is, I mean, is there fear? Is there any concern that AI technology could replace RDs and the advice that they provide?
I think it is a concern, but I think that, you know, we can't look at it as if the sky is falling. Mm-hmm. We need to reinvent ourselves and show people where our personal knowledge and skills can really help them use AI to really take care of themselves nutritionally. I think it's something we all need to be aware of. It's something we can't just say, oh, no, that'll never happen, because a lot of people are worried about their jobs going away because of AI. But I really think, as our association, the Academy of Nutrition and Dietetics, is on top of this issue and is working very hard to be sure we're positioned in a way that we will still be relevant. And I really believe we will be.
Okay. Thank you very much. I know that abacus manufacturers are really doubting what you just said, but I do want you to clarify one thing. that many people may not understand. So an RD is a registered, is it RDN? Is it RD? I mean, please define it. I know we use it interchangeably, but maybe you can give us just a quick overview for those who don't understand.
Sure. We earn the credential registered dietitian or registered dietitian nutritionist. Back about 10 years ago, the Academy and the Commission for Dietetic Registration gave us the option to use the credential RDN, which stands for Registered Dietitian Nutritionist, because as a group, we felt like that more accurately defines our role. A lot of people looked at dietitians as someone who was in the kitchen with a hairnet and didn't come out and provide a lot of relevant nutritional care. And that was years ago, but we like the other thing is people call themselves nutritionists without having the credential. So this sets us apart from people that maybe are selling supplements or don't have the educational background, the scientific background that we do, so that people realize that they're getting information from a qualified professional. And our goal is to protect the public, and that's why we keep these credentials. We're licensed in many states also, in addition to being registered, and that is what sets us apart from certainly a computer. And also from other people who call themselves dietitians.
All right, well said. And honestly, the as rare as RDs are worldwide, I would think that it's a profession that is a viable profession for anyone for decades and centuries to come. There'll be a demand. We're not going to stop eating or needing advice about our nutrition, and it's a very, very important health consideration is what you put in your body, for sure. And so thank you so much. We'll be back with you, Ms. Goolsby. Thank you. And we are going to move on now to Dr. Mindlin. Dr. Mindlin is going to talk about how AI technology are enhancing public health strategies and initiatives. So she'll take the global perspective of healthcare, and she is Dr. Mindlin, extraordinary. I don't know what to even pick out from her CV. She's done a lot of things, especially in administrative functions and academic functions in nursing. Dr. Mindlin is a certified nurse midwife and is the chair of the graduate nutrition department. Graduate nursing department. Sorry. I don't make that mistake very often, but that's a good one. She has a PhD in nursing from Emory University and an MS in nurse midwifery from the University of Florida and a BSN from the University of Florida. So welcome. She is a Florida girl. We like having her here. Thank you so much, Ms. Dr. Mindlin, and please carry on. Thank you.
Thank you so much for having me today. This is a really, really fun topic. Artificial intelligence and information technology are allowing for healthcare communications, the provision of healthcare, research, and education in a lot of new ways. These systems are offering typically improved communication across the board between providers, hospitals, and pharmacies. They can communicate in real time and share information in real time. What these do is they allow for seamless transfer of information, which can include prescriptions, procedural orders, hospital orders, along with pertinent patient information that is needed about the patient's conditions. These communications really ultimately are for the goal of improving healthcare for people that are hospitalized, but also care for those who are returning to the community or returning home. These technologies also allow for ongoing risk assessment in the community. So we can pull data from multiple systems to be analyzed for evidence of the spread of local infections or illnesses. And this information can also be shared with the providers in the community so they can be alert to the signs and symptoms of whatever infections are spreading in the community. This will allow for rapid diagnosis of cases and improved treatments in real time. In our non-acute centers or transitional care centers, there can be central pods that are installed for patients to go and be a participant in their own healthcare. They can go to these pods and take their own vital signs, and then these are then sent to their practitioners and their providers in real time for monitoring their health conditions. For those individuals that are living alone, we also now have the technology to create robots, technical of providing communication so you don't feel quite as lonely in those areas. And this also allows for the provision of health reminders to these individuals. The artificial intelligence in these robots will allow for kind of casual conversation. So you can have a conversation with a robot like they're a real person, while the robots are capable of listening for sounds that might indicate that outside help or outside health assistance is needed. This allows individuals greater autonomy as they gradually age. And then, of course, specific to Keiser University, because I have to talk about that, these technologies also are changing how we teach students to provide healthcare across all healthcare professions. We have online virtual simulations with AI patients who are capable of responding to student questions. We have simulation robots who are capable of initiating various reactions to student examinations. And then we are also capable of teaching lessons over what we call typical gaming platforms, and thus making learning really fun and exciting. So there's a lot of new technology out there, and AI and information technology is really changing kind of the provision of healthcare, both across the board in a lot of different settings.
Excellent. Thank you. Thank you so much, Dr. Mindlin. You raise a number of great questions. And actually, I'm going to prompt everybody else on the panel. So when we go through our first initial round, I'm going to ask all of the members of the panel to think about how we are utilizing instruction of using AI in our academic programs, our graduate programs, because obviously this isn't a skill of using it requires advanced knowledge, and advanced knowledge is what you gain from graduate education of all kinds. So talk to me a little bit, Dr. Mindlin, about how in graduate nursing programs, technology, specifically AI, is taught, applied, how our students are learning from that technology, if any.
AI provides us a lot of new opportunities in terms of teaching students in ways that might not have had maybe 5 or even 10 years ago. There is now the capacity to learn and interact with patients over the computer. So we can do this via Zoom, we can do this via Teams, we can do this via a lot of different EMSs such as Blackboard. And students have the opportunity to learn in a controlled setting, try out different questions, figure out what's going on, use their assessment skills, apply their knowledge of pharmacology, apply their knowledge of pathophysiology in new ways, interacting with almost like computer simulated patients who have a whole host of reactions that they can respond in order to provide new learning opportunities for the students. This can also be done in a face-to-face settings. There are computer robots that are also capable of providing reactions. We have kind of formal robots where you can do physical assessments and you can hear lung sounds and hear cardiac sounds from them, and we can change the lung sounds and change the cardiac sounds so the students can hear what different things sound like and learn how to diagnose them and learn how to treat them in those various settings. And then kind of one of the newest forms of technology out there is taking our lessons that we're learning and putting them within a gaming platform. So you're kind of having fun while you're learning at the exact same time. You can use that to practice test questions. You can use that to learn new information. You can use that to explore the body, such as I remember when I was going to school, I kind of learned anatomy by coloring in one of those anatomy coloring books. That was very difficult, but you can now do all that online and almost play, that operation game with different body parts online. You can learn anatomy and physiology that way as well.
Wow. I remember that. I definitely did that, and often I got buzzed for touching the wrong spot, but that's how it goes. That's how you learn, and that's good corrective action. So thank you, Dr. Mindlin. We will be back in touch. We'll talk to you more about programs in nursing and AI, and we appreciate your input. And we're going to move to Dr. Greenwood. Dr. Greenwood, she's going to talk a bit about what advancements have been made in personalized healthcare through AI, particularly in nutrition and patient care. Dr. Greenwood is the chair of graduate nutrition at Keiser University. She has worked in a variety of settings, many different universities, has provided leadership. She's an extraordinary leader here at Keiser University. She went to the University of Surrey in the UK, where she got her PhD in education, and also has degrees from the University of Central Florida and Madonna College. So we are delighted to have Dr. Greenwood with us. Hello, Dr. Greenwood, and we look forward to your comments. Please take it away.
Thank you, Dr. Keintz. And fortunately, I've had excellent speakers ahead of me that I can really build on. And what I really would like to share about AI, I spend a lot of time in community nutrition. And in community nutrition, we are picking up the medical care. We call that continuum of care from discharge of hospital. And AI has allowed us to have that good communication, as Dr. Mindlin talked about, getting that key information that we need. But it also has helped us identify the psychosocial and environmental influences that also affect the care of our community patients. What I mean by that is AI can help us identify food insecurity, different food desert areas, lack of transportation, even to medical care or the grocery store, or even the location of grocery stores within a food desert area. It has allowed us to be able to map and analyze our counties and then start to do some comparison of data of other counties, states, national, and even worldwide with the food insecurity scarcity that we have. And so AI really is helping us look at, from a community needs assessment, or now in our profession referred to as a community audit, looking at where we lack the resources that we need to provide our community that continuum of care. They're getting excellent medical care in the hospital, in outpatient clinics, but for many, they need to come to various free clinics or public health clinics where we continue to want to provide that same quality of care. But we have to address those other influences that sometimes are very important and very restrictive in their care. And so in dietetics and nutrition, I knew this was going to happen. In dietetics and nutrition, please excuse me for a minute. There we go. In dietetics and nutrition, not only do we look at the medical care of the individual, but we have to focus on the other influences that surround their care. And that's very important, the psychosocial and environmental influences. And I'm very lucky to be able to work with these other colleagues that offer me input, because I have reached out to them with questions and to say, what can you recommend? How can I better collaborate with the other health disciplines? So thank you, Dr. Keintz, and thank you to all of you.
Outstanding. Well, thank you, Dr. Greenwood. We will be back with some other questions for you. I'm going to go to our last panelists here, and then we'll come back with some general questions. So thank you so much for your participation today. We're going to move to Dr. Francois. Dr. Francois is a professor of nursing. She is going to talk about the influence that AI has in development and effectiveness of mental health treatments and therapies. She has a specialization in mental health nursing, and she is a faculty member at Keiser and is a licensed advanced practice nursing, and is duly certified as not only an FNP, but also as a mental health nurse practitioner. So we are very fortunate to have Dr. Francois with us. She also has her education from the great state of Florida, so we're very proud of that too. So thank you, Dr. Francois. Take it away. Thank you.
Well, thank you so much, Dr. Keintz, for that kind introduction. I appreciate that. But, thinking about AI and how it affects mental health, I want to start off with a recent study that was done just last year. It was a prospective study, and it looked at about 204 countries, and it found that mental health is increasing 48% of that entire study. 48%, mental health is increasing about 48%. So over the last 10 years, and it's really not getting any better. So, just to bring up a point. So what we need to do is come up with better ideas, bigger ideas, and using AI seems like a solution to, a problem that really we haven't been able to solve. So mental health in general is very complicated. There's so many different disorders that, in psychiatry alone, I find providers find it very difficult to even differentiate, one disorder from the next. But AI, with the use of mental health professionals, I do believe that, great change can take place. One of the things I want to mention about AI that really, it's kind of hard to say that AI will solve all of, mental health problems is that, AI can't empathize. AI has the inability to really connect, that human connection that a physician or a nurse or, any human person can provide. AI does not provide that. But there are some benefits. And one of those is that when speaking about AI, there are patients who really refuse to speak to a provider. And the reason why they do that is their fear of judgment, their fear of being put into a box or stigmatized and thought of as being a mental health patient. And by having AI or incorporating AI into mental health, I believe that judgment can be put to the side because, again, AI does not have the ability to really judge or to provide negative feedback in a sense to make that person feel, ostracized in a sense, right? So I think moving forward, it will be a great asset to the mental health community. And right now they haven't been able to, technology and mental health has not been able to, incorporate empathy and connection, but I really don't see that being a huge issue. I think it will eventually, the tech companies and the healthcare companies, they will eventually be able to incorporate this aspect. And, and when that does happen, then we have to be on high alert. So right now, what they're using AI for is mostly data collection. So we are able to look into, the similarities of different disorders and depressive episodes. AI can help to differentiate the different subtypes of depression. And I think that's important because, as healthcare professionals, some details we can leave out that AI can actually pick up on. So it's really important to think about that. So, by utilizing AI, we can definitely gather more information, more data collection, and I think that will help our patients in the long run. So hopefully that is. All
right. Thank you, Dr. Francois. Excellent comments. Great to have a mental health expert to address some of these issues. I think sometimes that's forgotten about. And I think, one of the questions I have for you in regard to that is a lot of discussion about the application of AI to healthcare is in diagnosis and record keeping. So in the mental health area, is it as helpful? Because you see it from both perspectives. You see direct care physical care and then mental care as well. So tell us, how effective is AI in diagnosis and record keeping?
Oh, well, right now, I want to say they're using AI mostly to help with data collection and to help with documentation, especially in the electronic health records. You'll find that there's a lot of things that are automated in the healthcare records, and that's really due to AI. There's something called CPOE, which is the Physician Order Entry System. And if there's an error, if a medication was accidentally ordered, if there's allergies in which maybe the provider forgot to, or maybe they overlooked before providing or prescribing a medication, AI really has the ability to detect that. And really, it can save many lives by doing that. So, and then there's also chat box, right? So it can help with chat box. So if a patient really needs someone to speak to as soon as possible, the only thing is the ability to empathize. But other than that, they'll have direct communication to someone right away without the wait, without being on hold or anything like that, because AI is really omnipresent. It's everywhere. There's no off time for AI, right? So it can really be helpful in the long run.
Okay. So just a more direct question on your preparation, Dr. Francois. I think that's an excellent response to that question. I guess what I would like to know is why you chose to follow and become certified in mental health. And how has, is that an avenue? I mean, you obviously chose that as an avenue for your career. Why would others choose that avenue?
So mental health hits home, and I think it hits home to everyone. And I don't think that there's any person who can say that they have never experienced anxiety, right? Anxiety is a natural mechanism, right? So we feel it when we're stressed due to maybe a test or any external factor can increase your ability to have stress, right? And really it's a protective mechanism as well. But depression, anxiety, bipolar disease, schizophrenia, it's becoming really prevalent, and there's a need. There's a intense need for it right now. And so I really see this being a field that we need to increase the amount of providers in this field. We need to increase the amount of knowledge, even for if you're not a mental health practitioner. I think it's important to still be able to detect some of these mental health disorders, so then you can refer patients to the right resources. So this is a field I chose because really it hits home. I had someone really close to me that went through a mental health crisis, and myself, I wanna be able to help people just as much as that person was able to help my close family member, right? So I really believe it's a field that needs practitioners who are heartfelt, who are ambitious, and really know their stuff. You really have to be knowledgeable in what you're doing. So,
well, I give you a great deal of credit for choosing it. It's a very, very popular field right now. Extremely important in nursing. Also, Keiser University has a clinic, a mental health counseling program as well, a master's degree, where graduates can become certified as a mental health counselor. Very popular programs. And very interesting is, you often hear this comment that, mental health practitioners in all areas are, they come from some problem in their own lives that they are trying to address or maybe save others from experiencing. I don't think that's all bad, honestly. It probably is the reason why we have so much interest in these fields today at Keiser and other universities. So anyway, thank you for your very astute comments. And I'm going to shift a little bit here. We just have a few minutes left here, about 7 minutes remaining. And so I want to ask some general questions. I'm going to start with Dr. Mindlin and follow with Dr. Greenwood, since they are the chairs of programs. I would like you to comment, Dr. Mindlin, a little bit about liability. Does AI increase liability in terms of for practitioners, for healthcare companies? Does it increase? Is it the same? Is there no risk? Can you talk to me a little bit about your perspective on that?
Thank you. The big risk related to liability is a concern that there can be a mistake that is made. Artificial intelligence emerges from the information that we all have, and emerges from the information that we put into the systems. It will only be as good as the data that we give it and the data that we provide it. We, as the practitioners, still need to double check what is actually being recommended, what are the forms that are being forwarded, and be very aware and have a very low threshold for questioning information that's coming from AI. Most of the time they do get it right, but there are occasions when AI may make a leap to a diagnosis or may a leap to a specific plan of care that may not necessarily be appropriate. In healthcare, we're taught to use evidence-based practice. And evidence-based practice, the essence of that is using the best evidence, which AI does have access to, but it also combines the use of the best knowledge of the practitioner along with the personalized information from the patient related to their needs and wants. And AI at this moment in time is not capable of pulling those other two aspects into care. It still requires professionals and practitioners from all levels providing their knowledge, providing their experience, and communicating with patients in a one-on-one basis to determine the care that's best for them. But AI is a significant help. It can help speed up time, it can help speed up diagnosis, and it provides a lot of capacity for improving communication and improving transfer of knowledge and transfer of information between different parties.
Well, I agree with you. I think Keiser University has taken that approach, which is AI as a tool to helping to educate students. It's not something to be afraid of. It's not going to replace us in any way. I mean, unless you're an abacus company, I don't really think, the key is don't be an abacus company, be something else, be better, move forward. And Dr. Greenwood, I wanted to ask you, as well as Ms. Goolsby as well, you're welcome to chime in on nutrition. On the same question, are there liability concerns in nutrition with regard to the applications of AI? Clearly you're dealing with risky populations. As you talked about, there being food deserts, and obviously in nutrition you deal greatly with folks who have obesity and issues of diabetes. So there are risks involved. Does AI help? Not help? It's all the same. What's your opinion?
I have to agree with Dr. Mindlin. I think it is a useful tool that we can use with our patients and with students. But again, you have to go back to what is best practice. And AI is good as what is inputted into AI. And again, AI is not that personal touch. You've got to be able to individualize to the care of the patient. So it's a good starting point, but we have to practice through evidence-based practice. Mrs. Goolsby, what do you say?
Oh, I completely agree with both of you. I think the other aspect is that as professors and instructors, we teach our students to think critically. And they still have to think critically when they're using AI because they need to assess whether it's correct. We teach that now. I can't tell you how many students will come to me and say, with a case study and say, oh, this patient needs 10,000 calories. Do they really? Do you think maybe we need to check your math a little bit? And So you can't just trust what comes out of your calculator, and you can't just trust what comes out of AI. You have to use your brain and think about it, make sure it makes sense. And that's why we need humans.
And you have to remember you're dealing with a person.
Right.
And AI just doesn't give that personal touch that we need to offer our patients.
Wow, that's an excellent segue, Dr. Greenwood, and thank you, Ms. Goolsby. Excellent comments, Dr. Mindlin as well. I'm going to pivot to Dr. Mundy and Dr. Francois for some last comments. But Dr. Greenwood, you sort of set me up here for this last question. One thing Dr. Mundy brought up in her comments a while back is she talked about the issue of the limitation is the connection with the patient. And that might be an issue with telemedicine. And so one of the things that brings to mind is just age. I mean, obviously, as humans age, it's natural that you would require more attention from medicine and medical professionals. Folks who are more aged obviously have more anxiety about technology. And so can you comment, Dr. Mundy or Dr. Francois, with regard to how AI, how it affects our treatment of those who are elderly, who need more care, and the accessibility of using technology in addressing some of the problems of those of aged individuals?
Yes, I'll go first with that one. So it also depends on the facility, and also you as a provider can help your patient figure out how to utilize technology as they go along. Like you said, especially as we get older, maybe difficulty downloading things, maybe difficulty seeing things, and as AI can be able to help out with either of those, where you can enhance things, you can see better. If you touch something, you can, it can be better that way. So I think there are ways getting around it, but yes, you still need that human to be able to show another human how to utilize that. So as we were just speaking before about the limitations, it can help out if you know how to use it correctly, but you need a human to be able to show that. So, if you have a department that helps the patient to download it and know how to use it, you give them instructions on how to do it. And if they have to be able to, get around it, how do you help your patient to be able to call and find out how to be able to get through the red tape as per se, if needed?
Yeah. Well, I guess very much so. And Dr. Francois, I'm going to jump to you. I guess it's all about whether you're giving caring support to a patient, any patient, and using the technology appropriately. That's really what it comes down to. So Dr. Francois, any comment you'd like to add to that?
Oh, yes, sure. So when it comes to technology, I do believe that even the aging population, they should still have education on some technology. And the reason is because it can really be beneficial to, send them reminders for certain things, maybe let them know when they need a doctor's appointment, maybe to take their medications if they're on any medications. So, having a team is a great, or at least an IT team, maybe a tech team that helps and goes out to help people utilize this type of technology, especially when it comes to the elderly population. I think it would be beneficial to them. So I don't want to say that they're incapable of learning, because a part of normal aging is, dementia and forgetfulness is not a part of normal aging. So they're still able to retain information. They're still able to learn new things. It's just a matter of not wanting to. They're still capable of it, unless they have some sort of, disorder that's causing them not to, like Alzheimer's or something like that. But they're still capable of doing so. We just have to increase their desire to learn those new technologies, and then provide them with in-person people who will teach them how to utilize it. And over the course of time, I think it'll be more beneficial than not to the elderly.
Very good. Very good. Thank you, Dr. Francois. And I would like to thank you, Dr. Francois, for your comments. I think you're right on. It is something that's necessary. It is a reality of our future using AI, whether you're in an aging population or not. The bottom line is we can all be more effective. I want to thank all of you for being here today. Those of you who are listening to this podcast, I would tell you again, this is Keiser University's graduate health department division. This is just a sample of some of the really outstanding leaders we have who are part of our classes. Imagine taking an online class with any of these individuals. These women are exceptional, very, very good instructors, excellent professionals, and experienced leaders. So we hope that you will contact us if you want to talk about these topics of AI or any topic in healthcare further. We look forward to hearing from you, and we hope you've enjoyed our podcast today. I thank the panel. I thank Ms. Lovo in Media Relations for taking care of our of managing and directing this program. And thank you, everyone. I hope you all have a wonderful holiday, and we will see you all in 2024. Thank you.
Thank you for journeying with us today on Keiser Voices, the story of success. As we close this chapter, remember, every story has its next page.